Excellencies, distinguished members, PCCs, and representatives from the UN agency and other organizations, through these 2 days of discussion, we have come up with consensus through the PCC's inputs and finalized our commitments with the Dhaka Declaration. I will not go through the whole paper, as already you have received it. I will read out only the action and request the Honorable State Minister of Health of Bangladesh to adopt the Dhaka Declaration. I will start from page 5 at the conclusion. At the conclusion of the 21st International Inter-Ministerial Conference, Dhaka, we, the leaders of PPD member countries gave a clarion call for: number 1, political collaboration. We appreciate the importance of policy dialogues, capacity building, technical cooperation, and hence we will augment high-level exchanges through regular summits, ministerial meetings to institutionalize South-South collaboration and promote capacity building in this regard, to ensure universal access to sexual and reproductive health, thereby achieving universal health coverage. Number 2, economic collaboration. We pledge to support each other's economic endeavors, deepen high-level exchanges, effectively utilize our demographic advantages to achieve a strong, sustainable, balanced, and inclusive growth. We will enhance representation of PPD member countries and partners in decision-making processes by including their perspectives and voices. 3, social collaboration. We will strengthen cooperation in public health sectors, including science and technology, health education, environment and climate change. We aim to enhance cooperation mechanisms and establish new platform for knowledge exchange, aiming for effective, accessible, sustainable, and resilient health system through collaboration. Furthermore, we commit to ensure universal access to sexual and reproductive health services, including family planning, maternal health care, and comprehensive age-appropriate sexuality education. We commit to achieving 3 zeros: 0 of unmet need for family planning, 0 for preventable maternal deaths, and 0 for gender-based violence and harmful practices. We recognize the critical role of gender equality and women's empowerment in addressing SRHR and pledge to eliminate all forms of discrimination, violence against women and girls. We also acknowledging the lesson learned from the COVID-19 pandemic. We commit to strengthening health system, enhancing disease surveillance, improving access to vaccines as essential medicines. We also emphasizing the importance of international cooperation and solidarity in responding to global health emergencies and pledge to build resilient health infrastructures capable of withstanding future pandemics. We also commit to actively involve young people at all ages of policy formulation, implementation, evaluation, and creation of opportunities for youth leadership, entrepreneurship, innovation, and thereby maximizing human capital and realizing the demographic dividend. Recognizing the emerging population development issue, such as low fertility and aging in many developing countries, we commit to make policies to provide healthcare services, nurseries, facilities, community support, tax reform, and social security schemes to improve people's well-being. We commit to promote inclusive economic growth, reducing the growing socioeconomic disparities, enhancing social protection systems, ensuring equitable access and opportunity for all individuals and communities, particularly those marginalized and vulnerable. We also commit to expand the digital workspace and build digital infrastructure, leveraging digital transformation opportunities and boost sustainable growth by emphasizing the importance of generating and utilizing data for evidence-based decision-making and policy formulation. Furthermore, we commit to adopt sustainable development strategy that promote climate resilience and mitigate environmental degradation by incorporating climate consideration into all aspects of national development planning, building on the commitments articulated in previous joint declaration, including those from international interministerial meetings of Bali, Nairobi, Thailand, and Victoria Falls. We reaffirm our collective resolve to uphold the principles of ICPD and goals of the PPD. We acknowledge the transformative potential of SSC in promoting mutual learning, solidarity, and collaboration among our countries. We commit to integrating SCC into the national development policy, strategy, and budget. We pledge to establish national task forces to oversee the institutionalization of the SSC and mobilize resources to support effective South-South partnerships. Acknowledging with appreciation the great contribution made by UNFPA, UN Office for South-South Cooperation, World Health Organization, and other UN agencies and international organizations in promoting SSTC. And commit to promote centers of excellence, accelerator for achieving ICPD and SDGs goal. We urge member countries to timely clearance of their annual contributions, as well as considering augmenting the quantum, and also appeal to the international agency with UNOSSC, WHO, especially UNFPA, to support PPD projects and activities with liberal funding to achieve the common goals of ICPD and PPD. In conclusion, we, the member states of PPD, reaffirm our collective commitment to working together in solidarity and partnership to advance the principles and the objectives of ICPD, promote sustainable development, and improve the quality of life for all. Lastly, and not the least, we profoundly express our heartfelt thanks and gratitude to the government of Bangladesh, PPD, and UNFPA for making this conclave a resounding success. And hence, we are adopting this declaration. Thank you very much.